Well, joining us now is Uwe Reinhardt. He's a professor of economics and political economy at Princeton University. He's also one of the country's leading experts on healthcare economics. So we'll continue this discussion about healthcare now. Obviously, this is landmark legislation. Uwe, what is your impression of the bill as it finally passed? Between all the back and forth and all the permutations, do you think that this is going to be an effective piece of legislation?
Well, it's a complicated piece that I tend to liken it to a house you just built. I don't know if you've ever moved into a freshly built house. For the first year you're in there, you spend a lot of time fixing things up or rearranging, stuff doesn't work, and so on. So with this bill passed, there are a lot of loose ends that need to be fixed. Foremost among them, the mandate to be insured is too weak for the insurance industry to be able to handle. What you will get with this weak mandate is what we have in New Jersey and New York, where you have community rating, meaning health status cannot be taken into account in the premium, but young people won't insure, knowing that should they get sick, they can then throw themselves on the mercy of this pool. And that does not work unless you have a better mandate. And there are ways to fix it.
But it seems like that this is how it stands right now. So what effect is this going to have that you say that the mandate is not strong enough? Does that mean that the folks who are part of this pool are going to be paying higher premiums?
Yes, it would drive up premiums. We had a taste of that with the WellPoint and others raising insurance rates. And yes, because the pool then will have mainly sicker people in it, and sicker people cost more, so the premium per capita will be higher. And that's not greedy on the part of the insurance industry. That's just actuarial science.
Well, Professor Reinhardt, is that part of what you had termed in the past the new social contract?
Well, the new social contract should be you must buy insurance whether you're healthy or not, whether you're young or not. Then you basically say when you're young, you're subsidizing the older and sicker people, and then once you become older and sicker, there are younger ones behind you who will subsidize you. That's the European approach, the Asian approach, but we don't have that yet here in the individual market. At the corporate level, you already have it. If you work for a corporation like Bloomberg, the healthier people are subsidizing the sicker people who work for Bloomberg. So we accept it, actually, as a matter of fact. But it's just for this individually purchased market. We've never had that.
So if you're looking across the healthcare industry, not just at the private citizens who are going to be buying into this insurance, but, you know, people at Bloomberg and at other corporations that pay in, is this going to do anything to lower healthcare costs, which was one of the stated goals of this whole endeavor?
Oh, I don't think it actually will lower the healthcare cost. There is actually a rule, and people should just understand it. The rule among health reformers is when you do a major reform, you must not immediately impoverish powerful provider groups.